use Symani during an open surgical procedure, the system is first brought into the operating room and made sterile by OR staff with the use of customized drapes and other sterile accessories. In this procedure, the surgeon will use the system to perform a lymphovenous anastomosis, or LVA, to connect lymphatic vessels to nearby veins in a patient with lower limb lymphedema. After the surgeon has manually prepared the vessels, the single-use wristed instruments are attached and engaged. The draped Symani system will then be brought into the operating field and positioned above the procedure site. Depending on the OR setup, the surgeon will either be visualizing the vessels through a traditional optical microscope at the bedside, or sitting nearby the table viewing a 3D monitor if using an exoscope. The surgeon, now sitting at the console, will then control the instruments by means of the handheld Opera Air controllers and foot switch. The controller's position and movements are replicated in real time by the instruments with a user-selectable motion scaling factor. Movement of the controllers mimics natural surgical techniques, allowing the surgeon to easily perform their anastomoses. The surgeon can use Symani to perform one or multiple anastomoses, depending on the procedure. Thanks to the design of the system, the surgeon or an assistant can access the anatomical region of interest manually, even while Symani is in place, or rapidly remove the instruments from the surgical site if needed, as no docking is required. Following the robotic-assisted portion of the procedure, Symani can be moved out of the operating field, drapes can be removed, and the system can be stowed.